Hi, everyone, and welcome to the Muslim Sex Podcast. Thank you so much for tuning in. I really appreciate your patronage, and I would love it if you could leave me a 5-star review because that really helps me. And if you could like and share this episode with somebody that you know that may benefit, your friend, your colleague, anyone, I'd really love you to share this podcast, especially if you find value in the Muslim Sex Podcast. Also, I'd love for you to subscribe to my YouTube channel and follow me on all my social media. Also, as you probably know, if you've been listening to this podcast, is that I have a practice that is now open in Chappaqua, New York. I see patients for menopause and sexual health, as well as regular gynecology. So if you are looking for a gynecologist that actually spends time with you, that has time to listen to you, then I would invite you to come and see me in my practice, and I'd be more than happy to take care of you. So make sure if you live in the New York area, or even if you don't, come and see me in my office. I'd love to meet you. And also, last but not least, is that I am hosting again my retreat in Morocco for 2025. So if you are looking for a gift for a family member, a friend, yourself, make sure you take a look at our retreat, the Love and Nourish retreat. It will be held September 19th through the 26th, 2025. Again, this year in Morocco, we will be visiting the same towns. We will be in Marrakesh and Essaouira. And as always, we will be providing information and lectures on menopause, perimenopause, nutrition, and also going for cooking classes as well as excursions. So don't miss out. I know a lot of people were sad when they missed out this past year on the Morocco retreat. So make sure that you go and visit the Love and Nourish retreat hosted by Caria Retreats. And now onto the episode. I am an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf, and this episode is everything you need to know about desquamative inflammatory vaginitis. I know it's a lot, it's a big word, but hopefully I can break it down for you and you'll learn something new. Before I get into it, of course, this is not meant to be any type of medical information. It never really, it is medical information, but it's not specific to you as a viewer. So if you have any questions about any of this stuff, make sure you go see a provider that can help you and answer all your questions. And of course, this is not meant to be any type of religious advice because I just don't give that. But in case you thought it was, it isn't. And if you have any questions about your religion, make sure you go talk to somebody that can help you out. Talk to your religious leader, all right? So it is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So today I want to talk to you about desquamative inflammatory vaginitis. And if you've listened to the last 2 episodes, you'll know that I'm kind of on this vulvar health kind of kick. So, the first episode in this series was lichen sclerosis. We talked about lichen sclerosis, what it is, how to diagnose it, how to treat it. And then the week after that, we talked about lichen planus, what it was, how to treat it, and what can be seen with it. And now we're going to talk about desquamative inflammatory vaginitis. And this is pretty rare. Okay, so I don't want you to go around thinking that this is pretty common. It is not. It's often associated with erosive lichen planus. So if you listen to the last episode, you will have heard about this. If you have not listened to the last episode, I'd ask that you listen to it because this is kind of like a follow-up to that episode. So you're going to learn a little bit more. So let's get right into it. So what is this? Desquamative inflammatory vaginitis, kind of like a big word, but it is a condition that can really horribly impact patients' lives and cause havoc on their personal self-esteem. It can cause havoc on their relationships, on their just everything. And it results in painful intercourse, bleeding after intercourse, this yellow-green discharge, and a lot of times people become very self-conscious, right? They have this constant discharge that's coming out of the vagina. They always have to wear a panty liner, right? This affects quality of life. They don't feel like they can go out, into the hot tubs or whatever, like a swimming pool, right? They'd have to wear like a tampon or something like that. So it's like this constant chronic discharge that is coming out, and it can be sticky. It can be, just annoying, but also it can really impact a person's self-esteem. So that's why we're talking about this. Desquamative inflammatory vaginitis, or DIV. So we call it DIV because it's such a long name, right? Is often misdiagnosed. So it can be misdiagnosed as yeast or bacterial vaginosis, but its unique features and treatment mean that getting it right really can make a difference and an impact in a patient's comfort and quality of life. So for those of you, listen, I get it, right? You don't always have time to listen to all of the podcasts. And, if I tell you to go to the other one, you may not have a chance to go to the other one. So I'm just going to fill you in and tell you what I talked about with the last episode and the patient story that I had. Okay. So I'll give you the short version because I kind of went through the longer version in the last episode in Lichen Planus. So basically, I had this woman, 38-year-old, never had any children, came to me as a referral from a dermatologist. And her story is that she had gone through years of infertility treatment, wasn't successful, had not been able to conceive. And then after that, after she stopped this treatment with the infertility, IVF, all this stuff, she then developed this weird discharge that started coming out of her vagina. And she said that it was this yellowish greenish discharge. And then along with that, she also noted on the outside of her vulva, she started to get these cuts, right? And that the kind of like the anatomy on the outside started to change a little bit because she was getting all these cuts on the outside, and then it was scarring. And then the anatomy was changing because of the scar tissue that was forming. And then she noted that when she and her husband would try to have sex, uh, it was painful. And not only was it painful, but she started to bleed after every time she had sex. Okay. And then this discharge never went away. So she saw all these people. She was seeing a midwife, and she saw her, and the midwife was not able to figure out what happened. And then the midwife, why she was having all this vaginal discharge. And then the midwife referred her to a dermatologist, who then took all these biopsies and started giving her all these steroids. And then also started injecting her vulva with steroids, right? Which I imagine was probably pretty painful for her. And still, she wasn't able to get the treatment or the diagnosis that she needed to figure out what it was that was happening to her, and why she had this chronic irritation, why she had this chronic vulvar discharge, and what to do. So finally, anyways, the dermatologist, who's a friend of mine that she was seeing, referred her to me. And then I saw her, and, I was looking at, examined her vulva. I did a full, thorough exam, and, she couldn't even bear to have an exam. Her pelvic muscles were so tight because she anticipated pain. And also, she was having all this like copious amounts of discharge that was coming out. It was green, it was yellow, but it was mixed with blood. So it was red. And it was like her vagina was a mess, and she had all these like little ulcers inside, and then she had this cuts, they look like little paper cuts on the outside. And so, I did a little bit of reading, and thankfully I have some friends who have written a book on vulvar conditions and vulvar pain and when sex hurts. And so I had the book. So there is a book called When Sex Hurts. I'll show it to you. It's this book right here. And one of the authors is Dr. Jill Kraft, who has been on my podcast before. And thankfully, she is a friend of mine. And so I reached out to her when I had this patient, and, we discussed it, and she gave me some treatments for this patient. So what exactly is desquamative inflammatory vaginitis, right? So I tell you this whole story just to kind of get you into the mindset of what it is that we're dealing with, right? We're dealing with a patient that has been suffering chronically from this discharge, from this pain, this bleeding after sex, but what is this DIV and why does it happen? So DIV Desquamative inflammatory vaginitis is a chronic inflammatory vaginitis that affects the vagina and the vestibule. So the vestibule is the opening to the vagina, okay? And it's predominantly in perimenopausal white women. This woman is 38. Could she be perimenopausal? Yeah, sure, she could be perimenopausal. I don't think she is, but it could happen. She is. We know that perimenopause can even start in somebody's late 30s, definitely 40s. But for this woman, right, she's been suffering for like at least 2 years prior to seeing me. And so it's characterized by this purulent. Purulent means, kind of filled with like pus, right? And so it's characterized by this yellow-green discharge, which is what this patient had. So of course, anytime we have like different colored discharge, we always want to make sure there's no sexually transmitted infection, right? And so she'd been swabbed and tested like 50 gazillion times for like, gonorrhea, chlamydia, trichomonas, any one of those things to make sure she didn't have those. And that wasn't the reason why she was having this, crazy discharge. So once that was all negative, then they weren't really sure, how to treat her. It also presents with the itching of the vulva and of the vagina, and some burning, some irritation, and often pain with sex, okay? Because remember, this desquamative inflammatory vaginitis often is associated with, and when I saw it in my clinic, it was associated with erosive lichen planus, meaning this lichen planus, which causes ulcers in the vagina, had caused this, because it was erosive, because she was having all these ulcers, it developed a bacterial infection on top of this lichen planus, and that's where you were getting this yellow greenish discharge. So the underlying reason remains unknown, though the patterns such as elevated vaginal pH, parabasal cells, and that's actually what they saw. So when they took a biopsy of this poor woman's like vagina, because she kept having these ulcers and they didn't know what it was, it came back as parabasal cells, inflammatory exudates, and depleted lactobacilli, right? So basically the pH of the vagina has changed. Now, if you remember, when we are going through perimenopause and menopause, you can also see this elevation of the pH, right? So basically the environment, the microbiome of the vagina is changing in perimenopause, menopause. And it looks like also in this condition, this desquamative inflammatory vaginitis, you have a decrease of lactobacilli. We know that lactobacilli really help to maintain that microbiome in the vagina. And so when there's a decrease in that, when that changes, and basically here it's saying that it's depleted, that would make sense why there would be an overgrowth of other bacteria, right? So that's why you have this yellow-green discharge, because it is an overgrowth of bacteria that's happening. And also, it says that you can point to a possible immune-mediated or microbiome-related mechanism for the reason why a person ends up with like this yellow-green discharge. And some experts consider DIV as part of a spectrum of aerobic vaginitis, and it's distinguished by different bacteria that are inside. Okay. Anyways, how does this look? So now that we've talked a little bit about DIV, now what does it even look, right? How does it present? So people usually present with this yellow-green, non-odorous vaginal discharge. And that's kind of like the key there is, and of course, like I said before, you want to make sure there's no, any sexually transmitted infections. But if you see ulcers inside the vagina and you're seeing this discharge and you're seeing that the woman is having like this pain with sex and all of this itching and burning, then, it makes you think that maybe it's not an STI, although it could be a sexually transmitted infection, but that it's something else. There can be vaginal and vulvar burning, itching, tenderness, or discomfort with the intercourse or urination. And remember, why would there be pain with urination, right? Well, because she's getting all these cuts on the outside from the lichen planus. Now, is DIV always associated with lichen planus? I'll be honest, I don't really know. I don't, it can be, right? But because what's happening with lichen planus is that you're getting these erosions, you're getting these ulcers, and the erosive lichen planus is associated with this desquamative inflammatory vaginitis, because what's happening is that now that you're getting these erosions, you're getting this superimposed bacterial infection, which is causing this inflammation inside of the vagina. and this overgrowth of the bacteria. And that's why we end up giving like this compounded medication that has both the estrogen, the steroid cream, and the antibiotic due to the overgrowth of the bacteria. Now, exam findings. So you can do like vaginal mucosa, you notice it's going to be bright red. Sometimes it'll have like little, what we call petechiae, which are like red little like splotches, and erosions or bruising, right? That can be sometimes what it looks like on the inside. On the wet mount, if you do a wet mount, you can see that the pH is going to be greater than 4.5, and you may not notice any lactobacilli. Lactobacilli help to maintain the pH in the vagina, but they also, what they do is they prevent the overgrowth of bacteria. And so if you don't see any lactobacilli, it could be that, they're kind of all gone, right? And if they're gone, then that allows for other bacteria to grow. And you also may see some inflammatory cells, some parabasal cells that I said was found in this woman's biopsy that she had done. And as a diagnosis of exclusion, clinicians always, right? So doctors or physicians or providers always have to rule out yeast and BV and trichomonas and sexually transmitted infections and contact dermatitis. So it is a diagnosis of exclusion, meaning like, once you've ruled out everything else that could be causing these symptoms, because it's so rare, could it be this, right? So it's not the first thing you're going to think about, but it's something to keep in the back of your head, so that if everything else comes out negative, could this patient possibly have this DIV, right? Discriminative inflammatory vaginitis. So the diagnostic criteria, so the hallmark signs is that you have this purulent discharge, right? This green, yellowish discharge. You have some inflammatory symptoms. You're going to have, on the wet mount, you'll see white cells greater than epithelial cells. You'll have this raised pH. You're going to see parabasal cells, and you'll see those decreased lactobacilli. And although biopsy is not really needed, it can show some lymphoplasmacytic infiltrate and mucosal desquamation. So basically, you don't need to get a biopsy on this, right? But if you feel, I don't think there's anything wrong. I mean, although it is uncomfortable for the patient, that is a given. It is, nobody wants a biopsy taken up their vulva, that's for sure. But if it means discovering something that I didn't know before, like, for example, coming up with a diagnosis, like with the, where it's lichen sclerosis, lichen planus, then, you might have to do a biopsy, right? If you see some skin changes and you're not sure what it is, it's better to err on the side of caution, and it's better to get a biopsy to make sure that it isn't any like type of cancer, right? So I would, although, like I said, if you don't need to, if you can come up with a diagnosis without doing it, that's fantastic. But if you need to, and especially in the vulvar area, I'm always very cautious because I don't want to miss a cancer. So if you need to do a biopsy, and they're so small that they'll heal, and, you just get informed consent, you let the patient know, you give her some numbing, and then you do your tiny little biopsy, right? You don't need a big chunk of tissue. You just need something small, just to confirm that you are not missing anything scary like a cancer. Okay, so treatment. So treatment for this desquamative inflammatory vaginitis, because it is an inflammatory vaginitis, right? Like you have this overgrowth of bacteria in the vagina, you're going to need an antibiotic suppository. And so the one that I used on the patient, so I'll just finish up. So like I said, you probably already heard the story in the last episode, if you listened to the last episode. And if you didn't, I'd ask you to listen to it because it is a pretty good episode. But for this patient, with this DIV, along with this erosive lichen planus, after talking with Dr. Kraft, she recommended that, we give her estrogen, a suppository that contained estrogen to help rebuild the normal tissue in the vagina, to give her clindamycin along with a steroid, right? So the steroid is going to cut down the inflammation that's already happening inside the vagina. And remember, it's called DIV, right? Desquamative Inflammatory Vaginitis. So there's inflammation inside of the vagina. So you're going to give her the hydrocortisone, you're going to give her the antibiotic, and you're going to give her the estrogen to help with heal the vagina, restore that tissue, and get rid of the overgrowth of the bacteria, right? So that's what we used on this lady. And for the outside, because she did have the lichen planus, we use that tacrolimus. But for the inside of the vagina, that was the compounded medication. It was the estrogen, it was the steroid, and it was the clindamycin. This combined therapy, really helps patients a lot. And in this specific patient, she came back to me. She like gave me a huge hug. She was so happy. She'd been dealing with this for like 2 years. Nobody could come up with a diagnosis. She was bleeding every time she tried to have sex with her partner, that they stopped having sex. So once she was treated, once she was healed, and I did another vaginal exam, and it was like night and day. I mean, it was so much better that I gave her the go ahead to have intercourse with her partner. And then when she started to have sex and I saw her back in the office after that, she said it was amazing, and she wasn't as scared that she was going to bleed. And her partner, right? So remember, like anytime a woman has a sexual dysfunction, her partner, whoever that partner is also affected. Right. And that's something that you don't really think about. As a gynecologist, I'm always so focused on the woman because that's who my patient is, that you forget that they're a dyad, that they are part of a relationship, and that whatever the woman is suffering through also affects the partner, right? So say that he's worried that he's going to, cause her pain, or that he's going to cause her to bleed, or that he's going to cause some, just really pain, right? And bleeding after sex, that he's not going to want to have sex either. And he may start to develop some type of either premature ejaculation or erectile dysfunction where he's not able to maintain an erection because he's so worried about causing her pain. And that was the case for this patient, right? So, when she came back and talked to me, she said that her partner, first of all, was super afraid to have penetrative intercourse with her again because of all the trauma that she had been through, that he didn't want to compound that trauma. So he, for a long time didn't want to have intercourse with her. And then she had to also see a pelvic floor therapist because what happened is, of course, as you might imagine, anytime you have pain with sex, those muscles tighten up because they want to protect you. They want to prevent that from happening. So then she again developed, she, like my patient that had lichen sclerosis, developed secondary vaginismus. So now anytime she was going to have sex, her muscles cramped up, even though she wanted it, but she was having a hard time because her muscles still thought that she was going to have pain with the intercourse. So she needed to also go to a sex therapist or a sex coach, right? So she needed to work on her thoughts that would enable her to have intercourse again without those muscles tightening up. And so she was working on that. She was also working with a pelvic floor therapist to help loosen up those muscles, right? Because all of these things go together. So she was working with me, she was working with a pelvic floor therapist, and she was working with a sex therapist to help with her thoughts. And then the sex therapist, I mean, I would say that her husband probably also needed to see a sex therapist as well, that they probably should have been seeing the sex therapist as a couple together because he himself experienced trauma, right? So it was like she was suffering the whole time, but he was also suffering because he was afraid that he was going to cause her pain, cause her distress. So he didn't want to have sex. So then, I would have told her to actually both of them see the couples therapist so that they could have worked through it together. But anyways, once she got better, she was able to have intercourse and she felt like a new person. She no longer was having pain every single time. She wasn't bleeding. Her muscles weren't tightening up. And she felt like a whole new person. And so she was so grateful that she was able to get her life back. Because remember, she had been suffering for 2 years and she wasn't able to have intercourse. So with this medication, you see that about 50% of women will receive clinical remission in about 8 weeks. So they'll get better in about 8 weeks. 26% are cured in 1 year. And, if they are maintaining, so, the thing with this is that once we treat the bacterial infection, if they have the lichen planus, if they have this erosive lichen planus, they're still going to need the steroids and they're still going to need the estrogen in the vagina. So with this particular patient, we had her do maintenance and she did it once a week now. Now she's just on maintenance for once a week and she's going to continue to do it for the rest of her life. Because we don't want this lichen planus to develop as bad as it was. And because the lichen planus inside the vagina was erosive lichen planus that led to this secondary desquamative inflammatory vaginitis. We don't want all of this to happen all over again, right? So once the bacteria was gone, once the infection was treated, I just wanted to maintain her on this steroid therapy along with the estrogen. And that's currently what she's doing. And she's doing fantastic. In fact, I'm going to see her again at the end of July. And at the time of this recording, it's June 2025. So, I'll see her back in a month and I'll see how she's doing. I'll let you guys know. I'm anticipating that she's continuing to do well because she was the last time I saw her, and then we just kept her on maintenance. So, that's kind of her situation. And again, maintenance therapy is going to be probably long-term for her just to stay symptom-free. So, one of the things that's really important to know about DIV, desquamative inflammatory vaginitis, is that it can wreak havoc on your life, right? And especially if you don't know what it is, and it can cause pain with sex, it can cause bleeding after sex, it can cause just really, really a lot of discomfort and irritation in the vulva. And so the key is that if you start having those symptoms, where you're having this yellow-green discharge and it's happening all the time, and all of a sudden now you start to see some blood and you're having pain and all this stuff, make sure you go to your doctor, get it checked out. Again, if you don't have somebody that knows how to treat this or is not familiar, then go to the ISWISH website, which is the International Society for the Study of Women's Sexual Health. They have ISWISH fellows that you can find somebody in your community that deals with this, that's able to treat this. And if you're somewhere in the world, because this is a global podcast, if you're somewhere in the world that doesn't have a practitioner that knows how to treat it, make sure you give this podcast to them, because then you're teaching them and you're helping them and they are able to help their patients, right? So that the whole point of my podcast is really to empower and educate women throughout the world and their partners and anyone who cares and loves for women, right? This podcast is for anyone and everyone who just wants to know about sexual health, perimenopause, menopause, and all of the things that go in between. And so if you are somewhere where, your practitioner doesn't know about these things, just make sure that you go and give them this podcast, and then they'll learn. And then they'll be able to help you and they'll be able to help others along with you. So that's why this is so important. And it's all of our responsibility to share the knowledge. And so that's why I do this. But, I want to make sure that once you get this treated, the DIV treated, you want to make sure that you continue to use the vaginal estrogen, because that's going to help plump up that tissue, right? We know vaginal estrogen does so much good. And there are few and rare contraindications to vaginal, estrogen. I think the only contraindication I ever saw was like a history of a leiomyosarcoma. But other than that, and that in itself is rare. So, most people in the world can take vaginal estrogen pretty safely. And we know that with vaginal estrogen, it helps to recruit that blood flow back into the vulva. It prevents recurrent UTIs. It prevents overactive bladder. It prevents pain with sex. And it does so much good. We know that as women get older, they can die from a UTI, right? They can be sitting there and become septic and nobody ever treat them. Nobody know what's going on with them, right? They can become confused and they can kill. So, one easy treatment for that is to go on vaginal estrogen and really stay on it for the rest of your life. The way that you take vaginal estrogen is, initially, if you're just starting it, you do it once at night for 2 weeks and then twice a week for the rest of your life. So, I bring that up because not only is vaginal estrogen a lifesaver, but it's really important for women to maintain their vulvar health as they move on, as they get older and older. So that's why that's super important. And really, DIV is pretty uncommon. This desquamative inflammatory vaginitis, it is uncommon, but its impact is totally real. And, the answer to DIV is, a compounded medication that contains antibiotics, that contains estrogen, that contains a steroid, and is totally curable and treatable. And it makes a huge difference in the lives of individuals affected by this. If the symptoms persist despite using like antifungal, antibacterial treatment, remember, so if you are having this green yellow discharge, and you've been treated for everything and it's still there, it's still not going away, and you've been tested for all of the things that come to mind, like, sexually transmitted infections and, bacterial vaginosis, trichomonas, all of those things. And if all of those are negative, then you want to be thinking about this in the back of your head. And with proper diagnosis and maintenance care, topical antibiotics, the plus steroids, you can really help somebody by treating this infection and help them to reclaim their comfort and intimacy. And that's why this is so important, right? I mean, these things like this really make a difference in women's lives and people's lives, and really can change lives. So that's why it's so important, and it's really the responsibility of all of us who gain this knowledge to tell others that may not have this knowledge about these type of things, so that they can also be healed. All right. So, well, I am done here, and it's been real and really intimate, and I'm so super thankful that you tuned in and you listened to this, because it can change somebody's life. It can save somebody's life. So really important that you are listening. And I'd love for you to like it and share it with somebody that may not have ever heard of this. And remember, this is not meant to be any type of medical advice. So if you do have any issues with recurrent vulvar issues, itching, pain, irritation, bleeding after intercourse, chronic discharge, yellow, green, whatever it may be, make sure you go and get evaluated, because that is really what you need. And you need a proper diagnosis, and you need a proper exam to get the proper diagnosis. So until next time, I want you to know that I'm so grateful that you're here. And until next time, this is the Muslim Sex Podcast. So thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.